Hi, everyone. Hey, welcome. Doug here. Super excited to be able to be getting with you and to going over this webinar. We're going to be doing it a little bit different this month. Super excited to be able to have this little new format. We'll see how you like it as health professionals. But as you're coming on, again, you know the drill. Type into the chat who you are, where you're from, so we can see different places around the world where doctors are coming on. And again, go in the chat. We want to make sure it's working. Just real quick, say who you are, where you're from, and as the rest of the docs come on, we'll get rolling. So here's the format that we're going to roll with today, and I really want to get your feedback on as we move forward. In the past, in these webinars each month on the focus, we do the full webinar with the doctors and then talk about a few factors for the health professionals in the clinics that apply to you. And then we go and do the same thing again for the patients. But we've had some feedback that doctors, didn't necessarily need to hear the whole thing again. And so what we're doing is we're going to spend 15 minutes today just with health professionals, and then immediately, excuse me, immediately have you go into the room and we'll do the full presentation for the patient. So you'll be able to just have to see it one time. So we're really excited about that. Make sure at the end of this 15 minutes that you click on the link and that everyone has that ability to go into the other webinar room so that you can watch the presentation as we give it to the patients and the public around the nation. So welcome, everyone. Dr. Parker, Denver, hey, welcome. Chapel Hills here. Thanks, Joanne. We got Lincoln, Nebraska, Atlanta, Georgia. We got our office. We got Tucson, Arizona, North Carolina. Atlanta, how's it going? So we're real excited. Man, a lot more coming in. So we appreciate you guys again as you come in. Just jump in the chat. Let us know where you're from. And we'll go ahead and get started right now because we have a limited time. Again, for those that are just popping on, we're going to go for 13 more minutes with the health professionals. We're just going to go fast and furious on the things that are specific to you. And then we're going to go into the full webinar with the patients. That way you'll be able to only have to watch it one time. It takes a lot less time away from you, your family, your clinic, and everything else. So this month's focus is on blood health. And yeah, we did play the theme off of Halloween, and it's my favorite holiday and all that stuff. But the key is something that's really important that probably would have been the theme anyways, because of the new research that's out and telling us about what's going on today. How come these people are dying that are reasonably looking healthy? The athletes, the people, the CEOs, the moms, bodybuilders, over 60 of them in the last 18 months. What's happening with them? And it all comes down to the blood. And we'll get into that in a little bit more detail. So basically, health professionals, you're going to see a transition with me, a paradigm shift, especially as you come to homecoming and that over the next while, that we have learned so much with our data, with the new programs that we have, and looking back over the decades and saying, wow, what is the difference between the clinics and the doctors that really, really have a lot of success, that thrive, that go out and they're able to become legendary, versus the others? And I'm going to go hard on this and keep pushing it and pushing a few buttons. And I just want you all to be open to the mission of what Optimal Health Systems is about and what I'm about personally. And what I'm about personally, and it goes into Optimal Health Systems, and every single staff member here is committed to this, is to help you become legendary. And this month, we're focusing on the blood with your patients in order to become legendary. But I want you to understand that becoming legendary is something I want to ask you to really strive for and to look at in your life. So we're going to get to that in a second. But here's the reason the blood is so important this month. Number one, it's the most attributable risk factor for all-cause mortality. In other words, we know that blood pressure itself is the number one thing that you can check that is the most attributable risk factor. So bottom line is, it's something that's easy to check. Most people have high blood pressure. Too much pressure in the blood causes the top diseases today. And the main one, the number one disease that lowers the quality of life, ends life early, is heart disease. And blood pressure that's one of the conditions that's caused from hypertension or high blood pressure. We're going to go into that research with the patients also, so that we'll bring you that data. The other factor is the the blood determines whether nutrients and oxygen are delivered to the cells, and also whether toxins are taken away and eliminated. And so the blood is really critical. And we're not going to be talking about blood work and doing blood work or anything like that today. We're going to show some people's blood work, but we're not focusing on asking you to do blood work. We're not asking the patients to do blood work in this webinar. We're just talking about blood and the importance of understanding it. There's some things you can do without even doing blood work to lower your risk of disease, increase your quality of life, increase your energy, increase your happiness. And we're going to be going through those and asking the patients to make those changes. And so you know that this is what we're educating on, that you can come in from your clinic and help them. Now, doctors, you have the tools to become legendary. You have the tools to help your patients with blood. And again, not talking about blood work this month. We're talking about the products to be able to help improve the blood flow by increasing nitric oxide. The NOS Performance Pack, probably the absolute greatest pack that we've ever created to increase blood flow in the body, lowering blood pressure. And then also the BFF, the blood flexibility formula, the chews that help lower blood pressure, increase nitric oxide in the body, increase circulation, and then fruit and veggie that has the same characteristics on the nitrate side of it to be able to help from the nitrate pathway. You also have the holistic protocols. You have the blood pressure protocols, the nutrition, the exercise, the supplements, the details of that to give to the patients. And you also have the ease of prescribing and creating a residual income for yourself and helping the patients long-term, even after they leave your clinic, and it's direct script. And direct script is the key factor. Direct script is really the linchpin, if you would, in order for you to be able to really increase your patient's health and your residual income tremendously. And if you're not using it, highly recommend you start using it. So using direct script, doctors, to become legendary, especially as we're talking about the blood, we created a challenge and we sent it out to all of you. And the challenge was for 3 days to do 10 direct scripts a day. And the reason we did that, and we put a lot of stuff with it. We put the ability to get some free of the brand new organic vitamin mineral gummies that's taken us years to finalize and create. So there isn't any synthetics in it that we're launching. Here in a week, we gave you the ability to get some of those free and to order them before everyone else if you did this challenge. And even if there wasn't those gifts, if you would, or incentives to do the direct script challenge we've had over the last few days, the fact that you now can get into the habit of doing this and seeing the tremendous impact on patients that you're no longer necessarily seeing that you're doing the direct script to, and also the income that increases from this, that in itself should be enough reason to get on board, to get out of your comfort zone and use direct script. So what's happened is, for those of you who didn't know, or you didn't do the challenge, 10 direct scripts a day, and for 3 days you were asked to do. And this is a list of the doctors that did it. And we even had some like Tanya and Brenda Chamness that went way above. We did 64, but we're talking, Dr. Reiner, Dr. Smith, Dr. Krawick, Allred, Mestis, Trejo, Parker, Brockman, Vieira, Sims, Nelson, all of you. And then Dr. Ridgway even clicked in and said, hey, I got started a little late, but I'm going to already have it set up and going to get it done in the next couple of days. So, and so I'd like to ask all of you that are on here that aren't a part of this list, that like Dr. Ridgway, still do it. The point is to do it, to take advantage of the fact that you're creating a new habit to become legendary. In the legendary doc that we talk about, in order to be able to help patients get better faster, to create residual income higher than what your expenses are each month, and for yourself to have optimal health. So shout out to these docs, guys. Thank you so much for taking that challenge. And I ask you to continue on with this new habit and start recommending your patients to take the nutrients, make this prescription off a direct script so that they can get going, and make sure you use that auto ship feature so that you'll be able to start getting that residual for life. They'll get that help for life. It's one of the greatest things you can do for the patient's health and also for your wealth. So doctors, without commitment, you cannot have depth in anything. And please understand, you can't have depth in anything, whether it's a relationship, a business, or a hobby. You can't do it. You have to have a commitment. And I'm asking you to look to the things that you could commit to become a legendary doc, to be able to help the patients get better faster, to make a tremendous amount of income from that work, and then also for yourself to have optimal health, to actually be an example, a walking testimonial of optimal health, of your clinic, of your mission, of what you stand for. But you have to have that commitment. The commitment means that when you say you're going to do it, it's non-negotiable, non-negotiable. And when you make something non-negotiable, the world changes, completely changes. Things will bow to you, everything will bend because you've made a non-negotiable commitment. And if you'll do that to become legendary, commit to become legendary, focusing on patients getting better faster, that'll help you do direct script, do your treatments in a way that really is bold, but the patient feels that you care about them. It'll help you get that residual income, and it'll help you form habits that you know you should be doing to have optimal health. And one of my favorite people that I spoke with back in the day, many times at the Parker seminars, Jim Rohn, he said, if you really want to do something, you'll find a way. If you don't, you'll find an excuse. And so I've heard so many people say, I'll make that commitment, but no buts, non-negotiable, non-negotiable. Doctors, this is a great month using the blood, using these focus that we're going to go over right now with your patients. We'll send you this slide deck so you can actually do this yourself. I'd recommend you watch this presentation. You get the slide deck from us and you do a Loom video or do a little video of you teaching this seminar. All you have to do is look at each slide and talk a little bit, and then have that for your patients or put it up on YouTube. We're making this extremely simple for you to become legendary in all aspects of health. So remember, legendary, you get patients better faster. How many of you do not want to get patients better faster? I mean, come on, we all want to get patients better faster, right? 2, you want to earn legendary passive residual income. And doctors, if you're not on board with this, and with the world the way it's going right now, you need to go listen to some of these people that are out there spreading the word. Grant Cardone, Tony Robbins, some of the greatest, I'll just go ahead and say CPAs, but higher than that, they're in the industry today. And these people are telling us what's going on, and we see it and we know where things are going. You need a passive residual income to pay for your bills if something happened and you couldn't work. And the way to do it is through the direct script, doing the scripts for the patient, having them on the formulas after they leave your clinic, that you have that legendary passive income. So when people come and say, well, how did you make it through that? Oh, I have my income taken care of, so it doesn't matter what I do, if I go to the office or not. That's legendary. And then again, to be a walking testimonial. Now, we did a study and showed that our top doctors actually are the ones that are exercising consistently, eating healthier, working to make improvements. They have more energy, they have more vitality, they're thinking clear. And so you're going to see a special group that I'm going to put together of legendary docs, ones that have already proven all 3 of these states. Now, not that you're where you want to be yet, but you work to get patients better faster, using direct script, you're getting the residual income going up, and you're a walking testimonial. Not that you're perfect, but that you're better than you were last month, the month before, the month before that you're heading the right way, that you become that walking billboard. Those of you that meet that criteria are going to come into a special master circle that I'm creating, that I think you'll enjoy a lot, with a lot of great benefits, where like-minded people can enjoy things. And we're going to bring some special speakers in to talk to you. So I'm hoping you're excited about that. Let me know in the chat and comments if you're excited about a special master circle for legendary docs. Okay. And so in the patient webinar that we're going to switch to here in just a minute, we're going to be going through the importance of the blood and why the main cause of low energy disease and the shortened lifespan come from the health of the blood. But again, not that they need to do the blood work right now, just the importance of it. What nutrition, exercise, and nutrients help the blood flow better and reduce blood pressure, and how they can take advantage of the nutrients and offer a special to them. So the special for you doctors, different from them, just so that you know, for being on this today, enjoying with us here in a minute on the webinar. Let's put the link in there. Make sure the link to the next webinar is in there right now. You're getting 20% off of BFF and the performance packs. Okay, right now. So you get 20% off of those. You don't have to have volumes or anything. It's just 20% off of the 2 formulas that we're talking about this evening. The 2 that are going to help the blood the most right now: lower blood pressure, increased sexual desire, because it takes the place of the Viagra's and those types of things. Helps with the blood flow, and we'll be discussing all those things. So that's your special tonight. The reps are staying a little bit late, so you can call in or just order online and use blood 20. Okay. And so on top of that, not only do you get 20% off, doctors, but you also, for every 12 you order, you get 1 free. So you get 20% off plus 1 free for every 12 you order. Again, so just a little extra help for you. Thanking you for being on, sacrificing your time. We have a larger group of doctors on right now. Thank you so much for being with us. And so what we're going to do is I want to again remind you, if you're not coming to Brimhall Homecoming, we've had two things happen in the last week that we don't even have on the agenda yet. That is phenomenal. I can't even share with you yet. I'll hopefully share it with you soon. But you want to come to Brimhall Homecoming. We have another announcement of a whole new program we're going to be creating there for you. Some of the latest things some of you have been hearing about going on in the industry today with amino acids and stuff. And then the second thing is that we're bringing in another speaker that a lot of you are going to know quite well from a big group that teaches doctors around the nation that you're going to love to hear about. And so as soon as I have absolute confirmation of those, we'll let you know. But get your tickets, Brimhall Homecoming. Okay. So right now, what I'd like to ask you all do is to click out of this, click into the other link that I think Josh just put on the chat. Please click on that. I'm going to go over right now. We're going to start the webinar for the patients. I'd like you to get the flow, watch how I'm speaking to them about this subject. We're going to send you this slide deck. Do your own, do a little video of it, put it on YouTube. It'll take you not even 30 minutes. And all of a sudden you have that there on there for life. And you now are the professional. You're the one that people go to on this subject because of your expertise. So we love you guys. Thank you so much. Again, let us know what you think about some of the things we got going on. And I'm excited to be able to talk to you and see you soon at Brimhall Homecoming.